Gotcha. And that's the home run. Welcome to the office. Hi.
Hi.
We're on day 2 of second round.
Yes.
And yesterday was a little spicy, the adjustment, right?
Yes.
What happened last night and this morning?
I just felt a ton of inflammation.
Okay. Where?
All in here. It was just a lot of inflammation. I did ice. A lot of ice.
In the front you're talking about?
Yeah.
Not the back?
No.
How about the tailbone?
The tailbone, it just feels like it shifted and it's just upright a little bit more.
Okay. And you said you're feeling tight and you have a sense of urgency again.
Yeah.
Or you feel you have a sense of urgency.
I feel it.
Okay.
It's not as bad as it ever was the first time.
Okay.
But all of a sudden it's just super tight right in here, like where the thighs meet in your bones.
So what she's referring to is called the inguinal ligaments or the inguinal canal. Did you do your walking yesterday?
Yes.
More walking or less walking than normal?
More walking than normal.
Okay. And how was your sleep?
It was really weird. I kept waking up every like 2 hours. I could just feel a lot of inflammation.
Okay. All right, let's see what happened.
Okay.
You ready?
Yes.
Let's check it out. It's not a bad thing. Actually, it's not a bad thing. It's not a good thing. It's just, let's see what shifted around for you. Okay, so what we worked on was, again, the Atlas and L2. And let's see what we got going on today. Starting at the base of the neck. Oh my God, it's clear up top. Okay, so when we go, the top is clear. Looks like there was a little bit there, but there's not. It's coming from, again, it looked like it was breaking, so it goes like this, it goes like this. Things are shifting around, madam. Shifting, goes to the left, and stops right there. Oh, madam, we have something new today. Acha. We're getting it around T10.
So my pain last night, it felt like there's a lot of inflammation. Prior to that, it just felt like my ribs were crushing. So I didn't have that pain. It was more of just a lot of swelling.
So what is inflammation? Inflammation is the body's protective mechanism. The good news is this is clear. Mm-hmm. I'm not getting anything in here. I'm getting around T9, T10.
And that's exactly where the swelling was coming.
Okay, and this is part of the adrenal system, okay? Mm-hmm. The fight or flight. No stress yesterday, right?
No.
Good. And I'm getting the left SI joint. It's the left sacrum, left SI joint. So I'm getting something different today. Let's feel the tailbone, let's feel L2, and let's see. Deco. Bunch. 5, 4, 3, 2. Different from yesterday.
Yeah.
2, 1, 12.
Ow.
12, 11, 10, 9. No. 10, 11. Or 12?
It's like 12 and 11.
So if both of them are tender, 11 and 12, which one do we do, Jess? If we have 2 bad joints, we could do the top or the bottom one?
The bottom.
You were guessing? Yeah. You should know, right? This is all based on foundation principle.
Yes.
So if you have 2 bad joints, one bad over the next, both are tender, we go with the bottom one. Feet together. Open and close the knees, open and close. Right side only, right side. That's actually moving fine. Left side only, right side only. We're getting it in the left SI joint.
Oh.
Come back slowly towards me. We're getting it here. Yes?
Yeah.
Yeah. This is left SI joint and T12 today. Things are still shifting, madam. You ready for round 2?
Yes.
There you go. So what we're doing is the PIIN, and to do the PIIN, you're going to stand on the EX side. In her case, the right side is the EX, so we're going to go over to the opposite side. The left pelvis is slightly down and in, so we want to bring it up and out. I'm going to be right here on the SI joint, okay? Right there. We're stabilizing the right side, and we're pushing the left up and out. If this is going out, this is going in. If this is going up, this is going down. So we're stabilizing the right, pushing with the left. Relax the right shoulder. And that's the home run. Gotcha. Hi.
Hi.
It wasn't so bad, was it?
No.
Good. And now your favorite.
You know, when I first came, I was really afraid of the adjustments.
Why were you afraid of the adjustments, Jess?
Because I assumed it was going to feel like you take a baseball bat and you just...
Who told you that?
Crack it. It just looks like that, like when you watch it. But,
okay.
But really, you don't even know because you do it so so methodically and so smooth. But yeah, so you don't feel, it doesn't feel as bad as it looks, if that makes sense.
Here's the thing. When you're on the right segment, going through the right line of drive, it could be spicy, but it's not supposed to hurt.
Yeah.
Does that make sense?
Yeah.
And it's okay if it's a little bit spicy sometimes. The deeper we can go on the adjustment is from the patient receiving.
Yes.
When you fight and you resist, that's when things start to hurt. And that's on the patient. That's not on the doctor. The second, that's number one. The second thing is, it's really about setting the vertebrae the way it's supposed to be set. Does that make sense?
Yeah, and when you do it too, there's not really a pain. I mean, it's a little spicy, like you said, but there's more of like a crazy emotional release that comes with it. And afterwards, so when you ask me like, "Are you okay?" Like I feel so like you just feel the emotional release, and it feels better.
Did it come out?
Yeah, it came
Chalo.
out.
You ready for round 2?
Yeah.
Chalo. 4, 5, 6, 7, 8, 9, 10, 11, 12. Now what I'm going to do is a thumb pisy contact to get a little more specific on it. My thumb is right on the spinous process. I need you to let that tummy go down, please. Oh, it's tight. Madam, that's fine. Bring your chest down a tiny bit. Bus, knees back. There we go. So, you're fighting? No, what happened?
I jinxed myself. Ow.
Gotcha. And again, that was a set. Come up slowly, please. Step away from the vehicle, madam. Here's my hand. And let's walk. Walk one more time back and forth, and then come back over here and have a seat, and let's rescope you and repalpate. A little bit different right now?
Yeah.
Okay.
So I have to be honest.
Please.
I feel like when I first came, I was in dire pain, like probably in May, it'll be like a year ago.
Okay.
And I had that hiatal hernia, and it was getting strangulated.
Okay.
And then I came, and you did about 4 to 5 adjustments in a week, and it went away. But I didn't do my due diligence to come back because I live far. And I was like, oh, I'm going to come back. I'm going to come back. And I didn't. And then I did the one thing you told me not to do.
Which was what?
Lift weights.
So you did lift weights.
Yeah, that's how I got this hip abductor issue. And I just didn't come back and follow through. And you told me, you're like, you know, some people, they have the structure and the composition to lift weights, and you do not. You can do other exercises, but
Correct.
lifting weights is not for you.
Not right now.
Yeah. And so for the people that are watching, I'm like, I literally didn't do my part. And when I came in here with that crazy bladder problem and you made it go away, that really shows me of how much, like, I already knew that this works because I was going to have to get hernia surgery.
Oh, you seriously?
Yeah,
oh, wow.
Because it was getting strangulated. And so then when I went back and they did an endoscopy and...
Hold on. So the original time you were supposed to get a hernia surgery...
Yeah.
Was last year?
Yeah, the hiatal hernia.
When you originally came?
Yeah.
And that cleared up. You got retested. They said you don't need it anymore?
Yeah. So when I went to get the, like the pre-op, they were like, there's no hernia. And I never have had that issue where it gets strangulated ever again.
Okay. And then you came back a few weeks ago for what?
Because I was using the hip abductor machine. And the next thing you know, I was using it really frequently. The next thing you know, I started getting extreme pressure on my bladder. Mm-hmm. And then I had the urgency of having to go 40 to 60 times. And so how I was telling you yesterday, you know, they ran all the tests and then they're like, you have cystitis, which is inflammation of the bladder.
Okay.
We don't know that though, unless we do that cystoscopy where they take a camera into your bladder. And they're like, but of course, we can't do that though until you've had these symptoms for, you know,
a while.
Yeah. Okay. 6 weeks to 3 months. And then I came here and you literally found that my L2 was out, corrected that. The very next day, never had that 40 to 60 times a day.
But I'm not treating that, am I?
No.
No. Guys, I'm not treating those symptoms. I'm just looking for the pressure in the nervous system. And it just so happened that that pressure was causing your symptoms.
Yes.
So that's kind of cool.
Yeah, it's really amazing. But on my side, like, I just know that I need to follow through and keep coming back until we get it all
sorted out.
Yeah, and everyone's alignment and story and how many times they want to go back to the gym and set themselves up is just different. So
right now it's about getting your structure, your foundation solid, doing your movements, your walking, your hiking, swimming, biking. Just be outdoors, be outside.
Yeah.
If you can.
Yeah.
And the gym and the weights and all that maybe later, but that's not really the goal and the focus right now. Right?
Yeah. So
on your back, bend your knees.
Okay.
Feet together. Let your knees open up. Open and close. Open and close. How is that on your inguinal?
It feels tight, like it hurts right in here.
Right here?
Yeah.
Okay.
No, like right in here.
Where?
Right here.
Yeah. 5. But here's the thing, right? You're saying cystitis. All that means is inflammation of a thing. What caused it? What's the cause of it? You get what I'm saying?
Yeah,
is it
root
chemical?
cause.
Is it chemical? Is it structural? Is it emotional? What is it?
Yeah.
And that's really the thing. So, you start reading a lot of stuff. You start to associate with these symptoms. As soon as you associate with these symptoms, what's the condition associated with the symptoms? And then the treatment. What's the treatment? And that's the thing in this work, right? In chiropractic, this is not a treatment, and there are a lot of titles out there saying chiropractic treatment. Chiropractic, is really about maintaining the neurological integrity between the brain and the rest of the body. Where is the nerve pressure? Correct that only and let the body function as it was intended to. Now, we start to get symptoms. We can have one nerve root causing 50 symptoms. And now we start chasing every single one of these. A treatment is done to you. Chiropractic done correctly is for you. Get the pressure so the body can do what it's intended. I know I keep stressing that.
No, it's so true.
I'm doing this for you. I'm doing this for patients. I'm not treating their leg pain. I'm not treating your sciatica. I'm not treating your neck pain. I'm getting the pressure off so that the body can do what it's supposed to do, guys. Guys, if you have questions, if you have comments, please leave a comment, ask a question, leave a suggestion. You have questions about chiropractic, you have questions about the nervous system, about the human frame, you have questions about body movement, anything. just leave us a question and we'll get back to you as soon as we can. Okay? Sound good?
Sounds amazing.
I'll see you
tomorrow.